Okay, so today we're going to dive into a topic that's pretty important, I would say. It's stroke.
Yeah.
And we've got a lot of information here that we want to try to condense and boil down into something that's digestible and something that hopefully our listeners can take some action on, right?
Absolutely.
So first of all, maybe we can just start with the basics of what a stroke is.
Yeah, so a stroke is, it happens when the blood supply to a part of the brain is interrupted or reduced, and that deprives brain tissue of oxygen and nutrients.
Right.
So within minutes, brain cells begin to die.
So this is a big deal.
Yeah, it's a huge deal.
And it can happen to anybody, right?
It can happen to anyone, and it can happen at any time.
So what are some of the things that put somebody at greater risk for stroke?
Well, there's a number of things. High blood pressure.
Okay.
It's a major risk factor for stroke, and that's because high blood pressure can damage your arteries, making them more likely to get blocked or to burst, and then other conditions like diabetes, high cholesterol, smoking, a lack of physical activity.
Wow, so it's like all the stuff that we're always told to be careful about is like directly tied into this.
It really is.
So how do we know, I mean, the time is of the essence here, right?
Yes.
So how do we know if somebody is having a stroke?
Well, the easiest way to remember the main symptoms of a stroke is the acronym FAST.
Okay, I've heard of this.
So F is for face drooping. Does one side of the face droop or is it numb?
Okay.
A is for arm weakness. Is one arm weak or numb? Ask the person to raise both arms.
Got it.
If one arm drifts downward, that's a sign.
Okay.
S is for speech difficulty. Is the speech slurred? Can the person repeat a simple sentence correctly?
Right.
And then T is for time to call 911.
So important.
If you see any of these signs, even if they go away, call 911 right away.
Wow, so that's a really good thing to keep in mind, that even if somebody's symptoms seem to go away, that doesn't necessarily mean that they're out of the woods.
Exactly. Stroke is a medical emergency, and the faster you get help, the better the chance of survival and recovery.
So there are different types of strokes.
There are.
Right, and I imagine that they have slightly different causes and maybe even treatments.
Yes. The two main types of stroke are ischemic stroke and hemorrhagic stroke.
Okay.
An ischemic stroke is caused by a blockage in an artery that supplies blood to the brain. This is actually the most common type of stroke, and it's often caused by a blood clot.
Okay.
A hemorrhagic stroke, on the other hand, is caused by a weakened blood vessel that ruptures and bleeds into the surrounding brain tissue.
So it's like a burst pipe.
Yeah, exactly.
Okay.
That's a good way to think of it.
So we've talked about some of the causes already, high blood pressure, cholesterol, all that kind of stuff. But is there anything we haven't talked about yet?
We have hit on most of them, but it's really worth emphasizing high blood pressure.
Okay.
I mean, that is the single biggest risk factor for stroke.
Yeah.
And it's something that you can control with lifestyle changes and medication.
So if you have high blood pressure, that's like a really good reason to try to get it under control.
Absolutely.
So what happens if somebody does suspect a stroke? How are they diagnosed, and what's the initial treatment like?
So the first thing that will happen is a doctor will do a physical exam and ask about the patient's symptoms.
Okay.
They'll also likely order some tests like a CT scan or an MRI to see what's going on in the brain.
Okay.
And then treatment will depend on the type of stroke.
Okay.
For an ischemic stroke, the goal is to restore blood flow to the brain as quickly as possible.
So that's got to be fast. Right.
Yeah, that's why it's so important to call 911 right away.
Right.
Because there are medications that can dissolve clots, but they have to be given within a certain time window.
Okay.
For hemorrhagic stroke, the goal of treatment is to control the bleeding and reduce pressure on the brain.
So then, taking all this together, it sounds like the biggest thing we can do is just try to prevent it.
Prevention is key. When it comes to stroke, and there's a lot you can do to reduce your risk.
Like what?
Well, we've already talked about managing high blood pressure.
Yeah.
But there are other things you can do too, like eating a healthy diet, getting regular exercise, maintaining a healthy weight, and not smoking.
Yeah, it sounds like good advice in general.
It is.
So really, the takeaway here is know the signs and act fast.
That's it.
I think that's a good place to leave it.
Yeah.
So on that note, when was the last time you checked your blood pressure or your cholesterol? I mean, those are things that we can do to really take control of this situation and hopefully prevent this from happening.
Absolutely.
Okay. Well, this has been a really great dive, and hopefully it's been helpful for everyone out there.
I hope so.
Okay.